I wanted to pursue an MBA degree because I knew that as a nurse I haven't received any business training, and as part of going into management and leadership at my organization, I was finding a deficit in my skills when it came to business and managerial leadership concepts, and I wanted to obtain a degree more formally in order to close that gap. I chose the Healthcare MBA at St. Thomas for several reasons. The first and primary reason was the fact that it had the healthcare component, which was something I was very much interested in and was searching for as I began kind of looking at various schools to pursue education with. The healthcare component was important to me because, again, I felt like I was going to have education that was more applicable to my business entity, which is healthcare. I chose St. Thomas because of their reputation, because of the cohort model. I really appreciated being able to stick with a group of individuals because I felt like, again, that was going to enhance and aid in my learning, to be able to get to know those individuals on an intimate level and then to be able to go on this journey with them. Some of the features that have been important to me in the program are the fact that St. Thomas really listens to the learner. They keep their learning strategies innovative and progressive. They've also demonstrated to me that they've changed course content based upon the evaluators from prior to me, plus the fact that healthcare is a dynamic entity and things are changing all of the time in that work environment, and they have kept up to date with those changes, and that was important for my learning. Another thing that was very important to me, again, is the cohort model and being able to be with a set of individuals and to really get to know them. And through that experience, I've been able to network not only with projects and those kind of things through my education, but also on more of a work-related basis. I have bounced work questions off of certain individuals in my cohort and have felt safe and comfortable to do that because I've gotten to know them on an individual basis. Our cohort is very diversified. There are nurses, physicians, and even nurses within different lines of the industry, whether it be more of a nurse manager role or a nurse that's working with insurance company, a nurse that maybe is in quality, and even the individuals in my cohort that are working with IT, and again, the insurance industry, quality, data, and that has really made it a very worthwhile educational opportunity, is to take all of those various facets of healthcare and to put them together in a room and to really think about the healthcare experience from a variety of those angles. There were a couple of things that I was a little bit concerned about up front before I actually made the commitment to sign up for the program, and the first being just not having any business background, and that was a major concern for me as a nurse because I haven't had experience with numbers and spreadsheets and those kind of things, but knew that that was an area that I needed to grow in. I was a little bit uncomfortable knowing, again, that there were going to be people in the cohort with that business background, and how would I fit in? Would I look ridiculous? As I talked about some of those key concepts, but have really found that that hasn't played out. There have been a number of key things along the way that have helped to diminish my concerns, and first of all is that everybody really is on a level playing field, and that not a lot of people have had the experience in those business entities or that niche of healthcare. And even those that have are very willing to help us all that haven't had the experience to learn, along with the professors are very accessible and very easy to talk with, to get a hold of if you do have a question. And so that fear was put to rest readily. Another concern that I had is just how to balance a young family and a full-time job and school on top of that. And really I have found that by, again, talking with others in the cohort and learning their organizational strategies and how they plan their day, and that really there is a lot of flexibility in getting the work done. It's just a matter of planning and kind of organizing yourself to meet the demands of regular full-time life and full-time job. Online learning was a bit of a concern to me as well because I have only known traditional classroom experience. And so I wasn't sure what I was going to think of that. I'm also very much a people person and like to see who it is that I'm interacting with. And I really grew to appreciate the online learning, that there were individuals in our cohort who you know, just responded differently when they had a bit of the shelter, if you will, of online learning, and really kind of came out of their shells in a different way that they did in the classroom. And again, that provided a very well-rounded experience for all of us. I also found the online learning very manageable from a time perspective, that I could get on early in the morning, whereas other classmates could get on late in the evening if that worked better for their home life schedule. And that was very much a convenience that I very much grew to appreciate. As a leader in nursing, I have found the value of the program time and time again. I use the tools and the skills that I've learned in this program every day in work and even in my home life. There are lots of opportunities for learning, whether it be how to enhance my networking capabilities or my leadership experience, and then also certainly the business savvy and being able to communicate with, you know, the executives in my organization in a different way than what I was able to do before. So there has never been a day that I've regretted this experience. It has been truly rewarding from both a career perspective and a life perspective. And I will take all of the things that I have learned and use them time and time again. So it is very much well worth the time, the effort, the money, and all of that, and you will be rewarded in many ways that I never even thought were possible. As a nurse leader, I have found that healthcare is changing, and it very much is more of a business today than ever before. And having those business skills of accounting, finance, being able to talk about return on investment are very important skills to have. I may not use those skills perhaps day to day, but they are needed as I think about the design of projects down the road, or even the ability to understand why maybe administration or the executive team is making a decision, and that it may not be you know, necessarily the immediate benefits, but that there's a long-term strategy and most oftentimes a business strategy behind some of those concepts. I think this whole experience has been a lot of fun. More fun than what I had anticipated it was going to be. I have made lifelong friends and lifetime contacts that I know I will use time and time again, whether it is a professor, whether it is a fellow student, or just the ability to pick somebody's brain about a topic that we're struggling with, that maybe we weren't struggling with 5 years earlier. And knowing that I have that bridge and that network now is very reassuring as I go into the next leg of my career.